My name is Fletcher Pierce. I'm a pulmonary and critical care physician. I currently serve as the vice president of Sentara Medical Group. If we review the quality issues that we had at Sentara, we found that about 70-80% of them were really related to poor communication or inability to communicate effectively. We looked at the workflow of our nurses and we found out that in a 12-hour shift, they may spend 60 or 90 minutes just trying to communicate, find the right people, and get the right information to them. They spend an inordinate amount of time away from the bedside of the patient, trying to communicate appropriate information. We had to look at all the different call schedules to be sure that they were correct in the first place. Many times they weren't, they were dated, they didn't even apply anymore. This was two parts. This was a unified scheduling platform and a unified communication platform. We recognized that we have been using people to solve problems, and we really need to utilize technology to solve problems. So we really started with our clinicians to figure out what was going to work for them. We looked at several different vendors. And we decided that we wanted a single source of truth. And we ultimately selected QGenda as our scheduling platform. We felt like they had the capabilities that we needed to integrate with Epic and also integrate with our paging platform. So that was a requirement. We wanted a scheduling platform that could integrate with our other technology solutions. Our change management strategy was fairly extensive. I spent a fair amount of time talking to physicians. I went to the medical executive committee at each hospital, or one of my colleagues did, another physician. And to get them on board, we actually made this part of their quality performance incentive to incentivize them to do the work. And when we did that, it was pretty easy because we could just lead with quality and safety, because that really is what this project is about. But also reassure them that efficiency is not going to suffer. In fact, it should improve. We actually created a website with education modules for hospital administrators, physicians, and office managers. This is how you're going to do it, and short videos on orienting them to QGenda, orienting them to how to use secure chat. We had town hall meetings for all the independent physicians to let them know why this was so important. This was about quality of care. This was about taking care of patients. I think the best way to gauge our success is adoption. Now we have well over 95% of all of our practices, both employed and independent, put their schedule into QGenda without being prompted. They actually understand that this is a quality and safety issue. This is an efficiency issue. The impact to the patient experience was exactly what we were hoping. We were hoping that folks would be able to communicate efficiently, quickly, and that's what we have found for sure. The net result is better patient care. We've broken down the communication barriers that lead to bad outcomes. By having this unified communication plan, we've virtually eliminated. And I think for any healthcare system that's going to undergo this type of transformational change, they need to understand that it's going to take time. You want to be sure that when you go live, you are very, very confident that all the schedules are correct, and you have at least 90% of them built before you go live. We did not dedicate a specific resource to this project in terms of an FTE. If we did it again, we probably would have. We formed a team of doctors, nurses, IT folks, project managers, and we met once a month. At least, if not twice a month, to keep this project on track. So there are several things that went into our timeline and the development of our timeline. One is, it so happened, several of our hospitals were actually upgrading their Wi-Fi at the time. We needed them to have adequate Wi-Fi before this would work. In terms of getting independent practices and independent providers engaged, we did a lot in terms of just going out and talking to people. And as we did that, we led with our why, which is quality, 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 safety, safety, safety. This is about quality and safety for us. You are going to have problems. You are going to hit roadblocks, and you got to be able to work through that in a collaborative fashion. We picked QGenda because we liked the people that we were talking to. We felt like we were going to have a good partner.